I'm Emily Mashak, and you're listening to Tuned In to NoCo, Town Square Media's show that lets you know what matters in NoCo. I'm talking today with Dr. Ken Thorpe, the chairman of the Partnership to Fight Chronic Disease and a chair at the Department of Health Policy and Management in the Rollins School of Public Health at Emory University. And we're here to talk today about COVID-19 variants and the vaccination. So thank you so much for joining me, Dr. Thorpe.
Well, thanks for having me on.
Of course. And now that people are starting to get vaccinated, millions of people have been across the U.S., what have we learned about the vaccine safety and the potential side effects?
Well, I think we've seen pretty much the same results that we saw in the clinical trials, that the vaccines are very effective, all three of them, at preventing people from getting seriously ill and ending up in the hospital. It reduces the likelihood you're going to be on a ventilator, and end up in the intensive care unit. And the side effects, when they do occur, which are rare, seem to be mild and are in short duration. So I think at least the evidence that we have to date on roughly the 10% of the population that's been fully vaccinated are very positive.
Now, in terms of COVID-19 variants, what do we need to be aware of there? And is the vaccine effective against those as well?
Well, what we can see from the underlying science of developing the vaccine in the first place, that it kills not only SARS-CoV-2, but it appears to also kill these minor variations around it. But I think the variants are an important reminder to everybody out there that we need to continue to do what works at preventing the spread of this virus, which is to wear a mask and social distance and do frequent hand washings. It's sort of simple as those sound, those things work. And I think that these variants are just a reminder that we need to be vigilant at continuing to do those until we really get to a point where we have 80 to 90% or so of the population vaccinated, which will effectively, hopefully, eliminate the transmission of this terrible virus.
And for those who do want to get vaccinated, how can they find out where to go, if they're eligible, when they'll be ready?
Well, yeah, so the state of Colorado is going to have, every state is different. They have similar approaches in that they're making older populations eligible first, people that have comorbid chronic conditions like diabetes and asthma and pulmonary disease, teachers, frontline responders available. So I'm sure you can go to the state of Colorado website to find out the vaccine sites. I'm not sure exactly what's happening there in Colorado, but in many states, Walgreens and CVS's drugstores are now providing the vaccine as well, and you can go on their websites. So we're getting more traction on producing more of these vaccines, but more, as importantly, we're getting more providers out there to actually administer them as well.
Mm-hmm. And clearly this will differ from state to state and might be different in Colorado. But have you seen a difference in the distribution of vaccines among communities, particularly among harder hit communities? Are they getting as much access as maybe more wealthy or larger areas?
Well, that issue of equitable distribution has been a big focus of the Biden administration. So in their 200-page pandemic report and plan, they focus a lot on making sure that we get the distribution of this so that it's fair, that it's going to low-income communities, that it's going to minority communities. And certainly, I think the data, at least up until recently, have shown that the percent of people that have been vaccinated are disproportionately not minority populations. And so I think the states need to continue to be vigilant to make sure that in their distribution plans, that they're making these vaccines available to minority populations. People that don't have health insurance, for example, don't routinely receive care through one of the big medical care systems. So I think states have an important role in making sure that we're really getting these vaccines out fairly across the board to populations that are low, high income, minority populations, and people who don't have health insurance coverage.
Now, where can people go to get information about the vaccine? I know we're hearing a lot about it, but where can they go to get the most accurate information on the safety, benefits, risk, so they can make an informed choice about whether or not they want to get it?
Well, I mean, the two places to go would be the cdc.gov website, Centers for Disease Control and Prevention, and also the fda.gov website. Those two sites are going to have the most accurate, most detailed information about the safety and efficacy of the vaccines. I know there's a lot of other websites out there that have information, but at the end of the day, you got to go with the science, and where the science is on those two websites.
So it'll all be on the websites, but can you give me a brief overview of what you think listeners really need to know about the vaccine?
Well, yes, what we know is that all three of them, the Johnson & Johnson, Moderna, and Pfizer vaccines, in roughly over 90% of the time, are going to prevent you from getting seriously ill, ending up in the hospital, so that if you do end up contracting the virus, which in a few cases can happen, even if you're vaccinated, but the vaccines are going to make sure that you don't get seriously ill. And that's, at the end of the day, the most important thing. We want to reduce mortality associated with the virus. We want to keep people out of the hospital, off of ventilators, out of the intensive care unit. And all three of these vaccines are very effective in doing all three of those things. So for my money, I'm worried about preventing really serious illness associated with this vaccine. And these vaccines are very effective at doing that.
Once someone is vaccinated, do they have to continue to wear a mask and social distance, or are they in the clear?
Well, the CDC is just starting to put out guidance on that. I think if you're in a room with everybody that's been vaccinated and has either the single dose or both doses, that's one scenario. But I think until we get more data and more information and more guidance from the CDC on that, I think the safest thing to do is to continue to wear a mask and social distance. But as we get more data and information, as more and more people are vaccinated, we'll have, I think, better guidance from the CDC on what those types of public engagement rules are going to look like.
And this might be another thing where we need more guidance, but can you talk a little bit about the period between the first and second dose? What is that? What is the risk factor like between people who have gotten their first dose but not the second yet?
Well, again, it's one of those things where we don't have lots of information. We know there's like a 3-week window between the first and second dose. All of the research and clinical trials that were done on the Pfizer and Moderna drug were based on 2 doses. Now, certainly we know that getting 1 dose is better than no dose. So it certainly provides some level of protection. There's not a lot of data out there that shows what happens after just a single dose, because again, the trials and the research that was done on this was based on getting 2 doses.
Right. And now clearly getting vaccinated is incredibly important, but I know a lot of people are still up in the air about it. What would you say to listeners who, even after hearing this, are still skeptical about getting the vaccine?
Well, I mean, just think about your neighbors, think about your parents, your loved ones. If you don't get the vaccine and you contract the virus, you're in a position of transmitting that virus to somebody else you love. So it's not just about you, it's about others around you that you can give the virus to. So, I would encourage everybody to get it. I know there are people who are either skeptical about it or don't like vaccines, but I guess that in my thinking, it really isn't about you. It's about other people that you love, people in your community. people at your work site, that if you don't get the vaccine and you get COVID and you transmit it to somebody else, well, that would be unfortunate. And that's something that we can prevent by getting the vaccine.
Mm-hmm. Well, thank you so much, Dr. Thorpe, for sharing this information today. I know it will be very helpful to our listeners.
Thanks, Emily.
Again, that was Dr. Ken Thorpe, chairman of the Partnership to Fight Chronic Disease and a chair at the Department of Health Policy and Management in the Rollins School of Public Health at Emory University. Learn more about the COVID-19 vaccine at cdc.gov.